So in this PowerPoint, we are going to talk about the growth and development of the babies. But in this PowerPoint, we are going to give a special focus in the developmental milestone, right? I mean, age-related activities, and same time we will talk about the some NCLEX question together. So here the growth and development, I said, what is growth and what is development? If you know, this is wonderful. So growth basically increase the size of the body, right? But development, not only the increase the size of the body, the baby also get the mental, psychological development, complete growth, right, or development. So again, I said the difference between these two, one is the physical growth only, the other is the physical and mental both. So a 2 years old child can walk up the steps and placing both feet together. The 3 years old can ride the tricycle. So tricycle, right? Easy way to remember. And when the 3 to 6 years old, they favor a parents of the opposite sex. Here. So here we are going to details more about the growth and development. Especially, we are going to talk about the developmental milestone here. So let me go through here. So like pediatrics assessment or milestone, you can see in this table the age, first month, 2 months, third, fourth, preschooler, and school age group or adolescence. I left some here, it look like bigger. So during the 1 month, okay, or let me explain. The age group 0 to 6 month, 1, 2, 3, 4, then next 5 and 6. So if I make a average 0 to 6 month, most important is the baby's safety. Safety is the super important in this time. Okay, and in this time, baby can do or can make the bubbling. They can make the bubbling, and also they can reflecting the smiling. I'm talking about overall 0 to 6 month. I told you in this age group, the most important is safety, right? And also 0 to 6 month, the body weight get double during the 6 month. So example, if a baby was born 8 pound, they should be 16 pound at 6 month of age. So this 0 to 6 month, the activities they do, they make bubbling, the reflecting smile, means if you smile, they smile as well. They holding the neck up and they rolling the back. They rolling the back from front to back, right? As I told you, in this time, the baby's safety is most important, right? And also in the same time, we will talk about the Most important, the NCLEX question, what type of question NCLEX asks, we will try to fit is as well here. So as I told you, when baby are 1 month, so in that time, what they do the reflex activities, crying. The way of communication is a crying, but the absence tear when they 1 to 3 months, and it is the normal findings. Okay, it is the normal findings I told. And safety, most important or important note from here, the safety, the place the baby on the crib on their back. Okay, so place the baby on the crib on their back. So the baby has to sleep or safe to sleep on the back. And when we tell or keep the baby in the crib, always place infant on back to sleep. Do not place anything in the crib with the baby. Then use the firm mattress or always fitted crib mattress. Remove the crib mobile by 5 to 4 months age, and make sure the crib sled are 1 to 3 by 8 inch apart, or also all of the part is raised, right? So if I go back again here, I said during the 1 month, safety is important and place the back or to the sleep. And also there are no pillow in the crib. Also monitor the temperature of the formula. When baby need to eat, is very important, need to the formula temperature. About the car seat, always use the rear facing car seat up to 20 pounds. Don't forget it, rear facing until 2 years old. Okay, means in the back seat, use the lower and also position the car seat at 45-degree angle. It is very important. And now go for the second. Okay, NCLEX board asks a question. During the first 6 months, what are the most important? The posterior frontanelli is going to close. What is it? This is called anterior frontanelli. The 4 bones is joined together. Okay, the 4 bones are joined together, and the frontal bones in 2 portions. There are 2 parietal bone, and they make the meeting point, and this one is called anterior frontanelli. And the posterior frontanelli is here. Okay, posterior, the occipital bone and 2 frontal bone. These are posterior frontanelli. So posterior frontanelli is closed by 2 months. Posterior frontanelli 2 months. But anterior frontanelli is closed during 18 months. It is very important. And the baby during the 0 to 6 month, they like the toy or best toy in this age group, 0 to 6 month, are noise making toy. 0 to 6 month, most or best toy in this group, noise making toy. Another note we have to know, before 12 months, baby are not allowed the cow milk. or any kind of dairy product. Very important, we should know. And then I'm going to go back. What are the other note we have to know from here? So during the second month, social smile. Also, they like the bright picture. They hanging the object. They like music. And as I show you, the posterior frontally going to get close. Safety, monitor the temperature of the bath, right? So keep in mind during the second month, raising the head when they are prone posture, important, we should know. Okay, so now we go for third month. Baby can sit with support. Baby can sit with support. So during the third month, only slight head or leg remains. So also they can turn from back to side. They can make a bubble. They like soft toy. And also we have to keep the side rail up when they sleep in the script. During the 4 months, most important, they rolls back to side and they can gain the head control. They try to put anything in their mouth, okay? And they also started to make a sound. They squeezing the toy and also they turn from back to abdomen. Always it is very important, we have to avoid the small object from the baby. So I just make it short, or what are the most important, let me explain. During the 4 month right now, we said baby rolls back to side, but the 5 months, they rolls from front to back. During the 6 month, they roll from back to front, right? And during the 7 month, they sit up and learn also leaning forward on both hands. And during the 8 month, they sit unsupported. And here we are talking about the gross motor skill. So what about the fine motor skill? During the, keep in mind, during the first month, as a RN or as a doctor, you has to check the reflex, all kind of reflex, like Babinski reflex, Moro reflex, right? We have to check everything is intact or no, any problem, like sucking reflex, rotting reflex, plantar reflex, Moro reflex, Babinski reflex, everything we have to check, right? So in the same time, it is also important we have to check the nutrition of the babies. Like as I told you before, 12 months, no cow milk, no dairy product, only breastfeeding. So breastfeeding or iron fortified formula for first year of life, no cow milk, and whole milk can be given after a year. So after 12 months, when baby started to drink, which milk is good? And milk is good for whole milk, right? So also it is important begin vitamin D supplement within the first few days of life. Alternate source of fluid are water, juice if needed, right? So what about the fine activities? fine activities. We finished the, we told some motor activity, gross activities, but fine activities also important. Fine activities are the reflex, right? So now go for the next page here. So the 5 months play with the toys and turn from abdomen to back, and also they like the noise making toy. Now we are going to talk about the 6 to 9 months. From 6 to 9 months. The most important point in 6 to 9 months, they like object permanence in this age group, 6 to 9 months. And also imitation of the sound. The imitation of the sound means what you say, they will repeat it. If you say dog, they will repeat dog as well. So repeat the sound, and imitation of the sound is the most important. In 6 to 9 months, I'm talking, baby sitting up without support, usually 8 months. And imitation of the sound, and also the baby say goodbye or bye-bye. And in that time, especially the 6 month, baby start solid food. First, solid food like rice, cereal is the best for this. And also in the best toy in 0 to 6 month, best toy 0 to 6 month are, they like building blocks, or they like to play the peekaboo. Very important. And also it is important, as I told you before, during the birth, the baby weight get double in the 6th month, but the 12 months, it will be triple the birth weight. So get back again, I'm going to explain a little bit more here. 6 months, hold the bottle, sit with minimum support, and their body weight get doubled. Means if a baby was born 8 pounds, they should be 16 pounds at the 6th month. But the 12 month, it would be triple. During the 7 month, they like to squeeze the toy and outlet cover or lock the cabinet, because they're so curious, right? And gross motor skill, the 7 month, they sit by leaning forward on both hands. Okay. And the fine motor skill during 7 months, they moves object from hand to hand. Whatever the 8 month, baby can sit without support. Without support, they like to play the game hind and seek with the mothers, right? So the gross motor skill, they sit unsupported, and fine motor skill usually like move the object from hand to hand, motor skill I said, right? So in that groups, in 8-9 months, the baby like peek above to play, safety supervision near the water. So if any near water is near, is very important to supervision, okay? Because to avoid any kind of accident, so avoid the accident basically. But in the same time, I want to tell you, So infant safety is super important. We have to avoid the choking hazard. Like we do not tell the baby to eat popcorn, raisin, peanut, grapes, or raw carrots, hot dog, celery, peanut butter, candy, or stuffed meat, because that kind of hard food can causes the choking and choking hazard. Also, it is important prevent the burn or prevent the drawing. So here now go the next here, and the 9 to 12 months. 9 to 12 months means 10, 11, and 12. In this age group, the verbal development is super important. They can start to talk. Language is important. Verbal development in this group. And also they standing alone without support, right? They crawling, they saying small word, and baby can sit in a car seat, and baby can sit in the car seat is not okay, and to take, and also baby can drink the cow milk, because we are talking about the 12 months, 9 to 12 months. So what are the most important in this age group? Verbal development, right? So like here 12 months, 11 months, they start to show the mood. Also use the index finger or thumb to grab something. During the 12 months, walk with one hand held or alone and triple their body weight. So their body during the 12 months, triple birth weight, right? Also during the 12 month, baby first go for dental visit. So as I told you, the verbal development is important in this age group. Language. So one word they start by 10 months, 3 to 5 word by 1 year old or 12 months, 3 to 5 words. Also, it is important separation anxiety work in the baby, because baby protest when separated from the parents. It is begins around 4 to 8 months age group. So if you tell the baby who are 8 years old, your mom in the school, and she will come at, like the baby's mom is a teacher in the school, she went to the school at the morning and she will come at 5 p.m. If you tell like this, your mom in the school and will come at 5 p.m. all day long, they will get anxiety. So separation anxiety is very important. And also the stranger fear, strange. So baby are less likely to accept the stranger in this age group, especially 6 to 8 months. Evidence between 6 to 8 months age group. Okay. So now go for next level. It is 15 month, 16 month, and up to 2 years. So basically 1 to 3 years old, 1 to 3 years old, I said. In this time, they like to play parallel play. 1 to 3 years or 18 months, they like parallel play. What is parallel play? Baby play side by side. They do not like to share at all, right? And in this time, the development of the gross motor activities, like baby can catching a ball, throwing a ball, they clumping, they jumping, they kicking, right? Another important in this age group, we are talking about 1 to 3 age group, 3 years or 18 months. In this age group, the posterior frontally here, anterior frontally is closed. Anterior frontally is closed during the 18 month, right? So now going here, let me see, so it is important. 15 month, basically pull and push like a toy they like. So this is pull and push like toy they likes. Also they likes to scribbling on the papers, right? So now here 18 month, jump on the both feet, 10 to 20 words vocabulary, anterior frontally close, and safety, place the poison in the locked cabinet, very important, and also forward facing car seat up to 20 pounds. And what about the 24 months or 2 years old? Okay, 2 years old. So in that times they climb the steps with both foot. They like parallel play. They like puzzling. They like blocks, building blocks, right? And also turn the doorknob. We have to supervise them near water or avoid any kind of hard meat, because to avoid the choking hazard, right? So what next? Next, we are going to talk about the 3 years old. 3 years old, basically they like to ride a tricycle. So this is the tricycle. Here, they like to tricycle, right? In 3, tricycle here. And also alternate feet on steps. What about the language? So language, they 900 word vocabularies. 900 word vocabularies, they start to say that. And here, they like puzzling, they like books, avoid. So average body weight is 33 pounds, average height is 3 feet, right? So here, I said the language is important, 900 word. And as I told you, separate anxiety when they 4 to 8 months, and stranger fear when they 6 to 8 months, and also age appropriate activities. As I told you a few minutes ago, when baby is 1 to 3 years old, they like parallel play, or it's called solitary play. So no interaction with any other children. But, and also the 1 to 3 years old, they're playing pet a cake, pet a cake. And if baby in the 3 years old, if they ride a triangle, ride a tricycle, they must wear the helmet. They must wear the knee pad. And stranger safety is important, right? It is not a good, or you have allowing to deal them with any bodies because of safety. What about the next 4 to 6 months? 4 to 6 months. 4 to 6 months, it is important. 4 to 6 months, basically, It is in this age group, they like to associate play. Associate play means like to pretend with a playmate. They like to pretend in this age group imaginary playmate they have. In this age group, they start to recognizing the color. And in this age group, 4 to 6, they like to learn by associate. The fine motor skill, they're trying to tie up the shoes, they scraping, they eating, they can eat by themselves. Also, they buttling their clothing. So in this age group are very magical, very visualistic. They like to imagine like anything is magic like this. Okay. In this age group, basically 4 to 6, they like the teddy bear type of toy, right? And especially the 4 months, the car booster seat. They can sit car booster seat. And some it is very important up to 4 to 6 months. Now we are going to talk about the 7 to 12 months, 7 to 12 years. Yes. So 7 to 12 years, basically this age group highly competitive. 7 to 12 years. Basically, this is the school age. Preschool is 4 to 6 years. 7 to 2 years is the school age. And 12 to 18 is the adolescence. So 7 to 12 years, basically, we are saying the highly competitive. Also, they like to fair play or justice play. In this age group, 7 to 12 years, they love to group work. They brush and wash their teeth independently. Independently or adult supervision. Under adult supervision, they can give the insulin. They can give insulin themselves and can check the blood sugar level. If you know that some of the children has a diabetic, is called juvenile diabetes. Usually juvenile diabetes is diagnosed in this age group, 7 to 12 years, right? So now we are going to talk about 12 to 18 years, like adolescents. In this age group, especially 12 to 18 years, they like internalization. Okay, they like peer association and self-development. The boys are 2 inches behind than girls. 2 inches behind means 2 inches shorter. Girls is little bit started the growth before than the boys. So what next about the school, I mean preschool or adolescence here? So the preschooler, what I said in this, I mean school age or preschool age, the children are they like to tie the shoes. They also like the some play the roles, games. likes to accomplish things, but accident prevention is the most priorities. I want to recap a little bit. The preschooler, some books said it is 3 to 6 years old. Okay. As I told you, when baby are 3 years old, they ride the tricycle. They jump off, right? Also, bottom steps. 4 years old, they can skip or hop on one foot. They can throw the balls, right? Use the scissor to cut out a shape. 5 years old, they jump the rope, and 6 years old, they identify the right from left hand. And you also it is here. And also, what about the preschooler other information related to the this age group here? As I told you, the preschooler, the key point about them, the key belief regarding the thinking were basic information. In this age group, I mean preschooler 0 to 6 age group, they are very magical thinking. The thought can cause events to occur, right? And preschooler age appropriate activities like they playing the ball, puzzling, tricycle, they dress up, and also associate play. They like associate play. Associate play means expected at this age. I mean, associate play is expected at this age group. When preschool age group means children playing together without much organization. Okay, and also I mean, definitely immunization is important. We already discussed in different class immunization. Nutrition is important in the preschool age group. Activity is important. Sleep is important because preschooler need 12 hours of sleep per day, and also consistent bedtime routine is important. Avoid allowing the preschooler to sleep with parents and use a night light. So also what are the different, I mean, if we talk about the preschool age group 6 to 12 years old, okay, especially some books say it is a schooling age 12, around the 12, but 6 to 12, yes, what is the most appropriate aging activities. So they interact with the peer groups. Like I said, 6 to 12 years or 7 to 12 years, very competitive. They like competitive play or cooperative play. They like board and video games. They jump the rope, bicycle, organized sports they like. They like some hobbies. And sleep needed basically 9 hours per night at the age of 11. Definitely immunization is also so important. So what are the most important in this preschooler or school age group? Injury prevention. So protect equipment, like if they go for bicycle or tricycle, they must wear the helmet, knee pad. So helmet, knee pad should be used when bicycling or they use any other device. and lock away the firearms or any kind of chemical should be locked up, and set the water heater, or do not leave the children unattended near a body of water like pool. Forward facing car seat or booster seat should be used until the child is 4 inches 9 feet. Or bicycle safety is very important in this age group, and make the bike is the right size. Okay, it is very important. Also, the direction of traffic, they should know. Wear the light color cloth with a fluorescence materials when they driving their bicycle. The last one from this PowerPoint is adolescence. The adolescence, I said. So adolescence, basically the age is 12 to 20 years old, but some books said 12 to 18 years old. The adolescent girls basically stop the growing or 2 to 2.5 years after onset of menarche. And boys the stop the growing at 18 to 20 years old. And sexual maturation order, basically the girls started some kind of physical change like breast, pubic hair, axillary hair, menstruation start, and the boys like testicular growth, pubic hair growth, then penis enlargement, axillary hair growth, facial hair growth, also voice change, most appropriate for the boy in adolescence age group. And in age appropriate activities, basically they like video games, they like music, they like sports, reading, and also some like the pet. Definitely the adolescence is immunization as important as well. Basically 16 to 18 years we give some MCV4 booster, also annual immunization vaccine is important. But most important is here the safety prevention. Safety prevention means sports injury prevention, firearms accident prevention, drugs, alcohol. They need sexual education, and also in this age group, high risks of suicide. So adolescence safety is the most important, the automobile safety. They always should wear the seat belt and do not use the cell phone when they're driving. Do not drive in impaired, do not drive impaired or with someone else who is impaired. Also monitor for mental health issue, including the self-harm, because this is group very dangerous, high risks for suicidal. Also discuss the risks of substance abuse, drug abuse, alcohol abuse, right? We have to monitor for sign of substance abuse as well. So this one, basically, this is more than enough about the developmental milestone, what is very important for NCLEX board exam.